This video will provide a recap of efficient moving and handling and will explore some of the commonly seen inefficient postures that people adopt. The content will be expanded on during the practical session. Standing in a top-heavy posture is very common. Some research indicates that nurses can spend up to 22% of their working time in top-heavy postures during an 8-hour shift. It is also very common during activities at home. Being top-heavy is very inefficient and develops excessive amounts of tension throughout the body. This tension can lead to stiffening of soft tissues in your body, which in turn can increase the likelihood of developing aches and pains, most frequently in your lower back, neck and upper limbs. In a stooped posture, your body has to work excessively to stop itself from falling over. When your body works hard in a static posture like this, the muscles are working under sustained tension and the blood flow to your muscles reduces, which over a long time can lead to a tightening of your soft tissues, increasing your risk of injury. To reduce your risk of injury, you need to think about the way you move yourself and the way you handle people and objects. Moving and handling efficiently can be broken down into 7 main actions. Getting as close as appropriate to your patient increases your ability to maintain balance. It also tends to increase the comfort and security felt by the patient by allowing more contact with their body. Taking a hold of your patient while standing directly in front or at the side of your patient can result in twisting of your spine. However, approaching your patient from an angle instead will often reduce the twists in your spine and will increase their comfort and security. In standing, there is a tendency for us to weight bear predominantly on one leg, locking out the hip and the knee, resulting in a twist in the spine. If you weight bear equally through both legs with your knees relaxed but not bent, your tension will be reduced, particularly within the lower back and legs. This more relaxed stance enables you to move to maintain balance should the need occur. When your feet are parallel to each other, you have less forwards-backwards balance. If you place either foot in front of the other, you have less balance side to side. Standing with your feet hip joint width apart, with one foot slightly in front of the other, will give you the best all-round balanced position. Your spine has about 140 joints and is designed for movement. However, if you allow your spine to bend forwards on its own, you will become top-heavy. Therefore, you have to prepare it for movement. You can prepare your back for movement by gently stretching your back upwards through the sacral area, continuing through into the lumbar spine. Doing this will encourage the soft tissues around your back and trunk to relax, which will help it to begin moving. When your back begins to relax, let your knees start to bend and your bottom to drop down. In other words, allow all of your joints to move. Moving like this will enable you to maintain balance with a minimum of muscle tension. When you start to grip something, the muscles in your hand will start to tense up. The longer you grip it, the more the tension will spread through your arm, into your shoulder and up into your neck. Also, when a patient is being gripped, there is likely to be a negative response, such as loss of balance, stiffening up or discomfort because of the amount of force applied. You can reduce this upper limb stiffening by taking an indirect hold with your elbows tucked in, which can reduce the spread of tension. You can take an indirect hold of your patient, not just with your hand. For instance, you can use your upper arm, torso and thigh. When you start to lift something, often the first thing you move is your knees. However, this will push you into a top-heavy posture. When you're about to stand yourself back up or move a patient or object, think about bringing your head up first to maintain your balance and spread the effort throughout your body. Remember, a hold should not be taken of your patient until you use the appropriate actions as already discussed.